ADHD. Why do so many women specifically, why are they misdiagnosed or diagnosed so late?
Mischaracterization that this is late onset ADHD, which it's not. Especially on social media, as soon as people see the quirky ADHD things that people do, they're like, I must have it. And it's like, well,
These are some of the things to look out for and maybe dig in deeper.
so we see women are often the inattentive type. So that's like, you might be a space cadet. You're daydreaming, you're spacing out, people are talking to you, but you're not really taking in what they're saying. Not looking at neurodivergence as like a disease or something that has to be fixed, but understanding that if you got this different operating system, you need to learn how to use it.
What are your favorite pro tips for sleep?
A dopamine anchor. So
Dr. Brighten, what the heck? We'll be back on the pod. Welcome.
yeah, thanks so much for having me. We're doing this in person.
We're doing this in person in your cabin in the Ozarks. I'm a couple cabins down.
Yeah.
We're here at this both a wellness event together, right? At Big Cedar Lodge. Shout out to Big Cedar Lodge. It's beautiful here, right?
Yeah.
Have you ever been here before?
I've never been to the Ozarks before.
Me either.
And I have to say, it's wild. We've been hearing geese and all kinds of noises out there. And I'm this is so amazing.
It's like Garden of Eden in the mountains. I highly recommend it. Big Cedar Lodge. If you're looking for a nature forest bathing type of destination, it's beautiful. And we're surrounded by deer and
taxidermy.
But it's cool. What I also love about it is last night I was learning about, the guy who owns, forgive me for not knowing his name, but he owns Bass Pro Shop. Mm-hmm. This is his thing.
Oh, really?
Yeah.
Oh,
That's
okay.
this is his passion is conservation, nature, hospitality, and the convergence of that. So yeah, he's done a lot. I think his name's Johnny, but don't quote me on that. But I'd love to meet him. Honestly love to meet him.
Yeah.
But it's wonderful. But how have you been?
I've been well. Yeah. We were just chatting that I'm pregnant.
You're pregnant.
That's a wild journey.
Yeah. How's it going so far?
You know what? So far, so good. It's so I have to be on immunosuppressants. I'm on low dose prednisone, but it was enough that the flu went through my house and I was sick for 2 weeks. And I usually get the flu and 2 days later, I'm back. I'm fine. And this lasted a while and I was like, oh God, first pregnancy immune system needs a bit of immunosuppressant. And I wasn't nauseous at all. And I was like, yeah, okay, maybe we're done with that. And then yesterday I woke up and I was feeling so much better, except the morning sickness was back. And I was like, of course it is. Of course.
So for people that don't know, why do you have to be on low dose steroid?
So I have multiple autoimmune conditions, but I also have adenomyosis, which it's diffuse adenomyosis. If people don't know what that is, look at a good marbled steak. And that's what a uterus with diffuse adenomyosis is. The fat pockets that are in there is this kind of scar tissue that's ineffective. And so it can be inflammatory. And so it's just a precaution that they're let's just dampen any kind of inflammation just in case, especially as we're waiting for the switch from, so people don't know, when you're pregnant, you'll go from having a robust Th1 immune system, which is fighting bacteria, viruses, to switching to Th2, which is to make you more tolerant to baby. So that's the big reason for that. I have Hashimoto's and psoriasis, but I haven't honestly had symptoms of that in a decade because of how I manage it.
Yeah. Through your life, right? Through what you practice and what teach people, you're doing it yourself.
Yeah.
Novel idea, right?
I know. When people are like, do you really eat that way? I'm like, yeah, I practice what I preach. But also when you have psoriatic arthritis in your joints and you're like, well, I like to walk. So yeah, I'm just gonna skip the fast food. When I tell people I haven't had fast food in decades, they're like, how is that possible? I'm like, well, it doesn't feel good in my body, firstly. Yeah. But secondly, it's a planning. I plan for things.
Yeah, you love feeling better more than you want something that isn't worth it.
Yeah.
It's like a bad trade-off.
Yeah, totally.
100%. Okay, so I'd love to dig into this topic because you're such an expert in it and not enough people know about it. They hear about ADHD in the form of maybe kids and parents, that sort of realm.
Yeah.
But there's a whole broad swath of people that are misdiagnosed or diagnosed later in life And hopefully through this conversation can be a big aha moment and help people get the help that they need.
Yeah.
So ADHD, why do so many women specifically, why are they misdiagnosed or diagnosed so late? And this is something that was caught as a kid.
Yeah. So there's a lot of mischaracterization that this is late onset ADHD, which it's not. You're neurodivergent or you're not, and you have this in childhood or it's something else, right? And I think that's an important distinction for people listening, because especially on social media, as soon as people see the like quirky ADHD things that people do, they're like, I must have it. And it's like, well, something like hypothyroidism can masquerade as ADHD. So we need to make sure that it's actually that. But when it comes to women specifically, so this is no surprise to anybody who understands that most medical research is done on men. And when it comes to ADHD, for a long time, the medical community said, this only affects little boys. And they would even say sometimes they grow out of it. Now we know you don't actually grow out of it. You grow into managing it and understanding more how to support your body, at least hopefully so, through your parents' guidance and having a good doctor. So with women, however, it doesn't look like it does in a little boy. So people are like, ADHD, little boy can't sit still in a classroom jumping around. And in reality, for women, all of that hyperactivity is actually very internal. So it looks like anxiety, very common. How many women are diagnosed with anxiety?
Yeah.
It looks like, oh, she's just spacey and forgetful. Oh, she's just somebody that like is bad with time. And so it's a lot of, normalizing what's not actually normal for women. And because women are really conditioned to always smile, do a good job, put other people first, work harder. There's kind of this good girl syndrome where they're highly masking and they're covering everything up.
Yeah.
And the problem is once you get into the hormonal chaos of perimenopause or postpartum, even starting your period, there's a theory of being very hormonally sensitive, which neurodivergent women often are. And so when there's these big fluctuations, that affects your executive function. It affects things like emotional regulation. I think a lot of times people forget that being emotionally regulated is an executive function that we learn as our brain develops over time. However, when it comes to something like PMS or PMDD, people will look at that and say like, well, you're just hormonal. That's all that's going on, and not recognizing that there's actually this underlying emotional dysregulation due to the executive functioning issues.
Wow. Okay. So what are the main symptom differences? You mentioned some, but if we could kind of bullet point like, okay, these are some of the things to look out for and maybe dig in deeper and get help for.
So we see women are often the inattentive type. So that's like, you might be a space cadet. You're daydreaming, you're spacing out, people are talking to you, but you're not really taking in what they're saying. When we look at, so a lot of people, you'll hear people say, everybody's a little bit ADHD. That's not true. You're ADHD or you're not. And the difference is that do the executive function dysfunctions actually interrupt your life, interfere with your relationships, interfere with your work. For most people, like everybody from time to time, has these dysfunctions, right? We, I think any new mom is like, the feeling the brain fog, not being able to multitask, like I can feel that. But for people with ADHD, the time blindness is what people will call it sometimes, is that you cannot actually plan your day based on time. You can't say like, I have to leave at 12, so let me back it up. What are the steps I need to do? That maybe makes you late for a job, makes you late to pick up your kids. So it's interfering with your life. So we've got the I'm inattentive. There is also thoughts that won't quit. You can't control them. This especially can show up at night when everything's quiet. And so having difficulty with these ruminating thoughts that are just on repeat, having trouble sleeping. What's interesting is that roughly 70% of those with ADHD have delayed sleep phase syndrome. So while the average person, right, we always talk about circadian rhythm and like turning off the lights and doing all that. And the average person, the neurotypical, their melatonin might rise like 9, 10 p.m., like they're going to bed. ADHD individual might experience that it's rising more like 12 p.m. So 1 a.m. is a better sleep time for them. So having those kinds of sleep issues can also be a problem. Mm-hmm. And then for women, especially as they age, brain fog. The ADHD brain, two things that are really important to understand. Not so good with neuroplasticity, measured by BDNF alpha. So lower in the ADHD brain, but also not so good at utilizing glucose compared to a neurotypical brain. And so when estrogen starts to decline and it affects the mitochondria, it affects inflammation, it starts affecting your glucose metabolism, we see much more brain fog, which we also see with things like hypothyroidism, which is why I'm always like, rule out the other things. And also no one said that you don't get to have two.
Right. Both and, not either or. So, okay, I'd love to dig into the weeds here, like the concept of neurodivergence. And you mentioned like neurodivergence or not, but then we know there's that genetic component, but then there's a lot of epigenetic factors, right? Where it's like more and more people, their genes are being stressed out like never before in human history. From many different epigenetic variables. So what's your thoughts on that? Like, yes, there's that genetic predisposition maybe early on in life, but do you think that some people could be more exacerbated or it could get harder to manage life because of time and exposure to different things? And maybe we can dig into maybe what are those exacerbators. But what's your thoughts on between the interplay, I guess, between genes and epigenetics with ADHD?
Well, I love that you asked this question because I feel like there's a lot, we were talking about before we hit record, like, people get mad on the internet, and there's a lot of nuance lost on the internet. It's something I talk about, like being neurodivergent. That is what you are born with. This is your operating system. So I like to say, like, there's the neurotypical operating system, which is like Apple, right? Super intuitive, easy to use, integrates with things so well. But then the Apple iOS tries to text the Android, and the Android is less intuitive and it's different. Like, I don't exactly know how to approach this. And that's really the neurodivergent system.
Got it.
It's not like people love their Android, right? It's not bad. It's not worse. It's just different. So there is the baseline, right? So with ADHD, autism, you have this genetic predisposition. This is your neurotype. However, absolutely, epigenetics influences not only the way the symptoms express themselves, but also co-occurring conditions that can go right along with that. And so, you know, we see that, for example, something as simple as the food restricting that can happen with neurodivergent people with ADHD. People, I think the average person is like, just meal prep. I don't understand. It's not that hard. So much executive function goes into going to the grocery store with a list, planning everything out, making sure that you have everything ready to go. How long is it going to take, like, to make this? And when am I going to be hungry? So, and with that, there can be a propensity towards just grabbing something convenient, right? That can lead to nutrient deficiencies. So something like zinc, for instance, we know is super beneficial for the ADHD brain and executive function. Omega-3 fatty acids as well. And so, you know, we can talk a lot about the other factors, but I think even just looking at diet of like, I'm not getting the nutrients I need to actually perform in the way I need. Like the cells need this to be able to do their job. And without it, they're not going to function at their best. And I think certainly as well, we see a lot more talk around autism and environmental toxins because we know there's gene clusters that can ride with it that make them poor detoxifiers. But with ADHD, you already have elevations in inflammation. You already have brain, dysregulation of your energy supply. There was an interesting study that showed that there was about a 240% risk of developing dementia if you have ADHD.
I saw that.
Yeah.
Yes.
Which is shocking. And it's something that, you know, taking, and there's people that are like, I never want to take ADHD medication. I'm like, that's fantastic. If you never need a medication, I 100% support that. And yet there's some people that they have substance abuse issues. What's interesting is taking medication in one study, people who were struggling with substance abuse, we saw a 30% reduction. And once they stopped the medication, that persisted. So we see that the medication can help with neuroplasticity. So ADHD medications do have a time and a place, but they're not the full picture and not the full story. And I took a little tangent there from talking about the epigenetics, but I think if you understand that you're at higher risk for Alzheimer's than things like smoking, alcohol use, skipping sleep, the other things we know are risk factors. Like, you're going to be more susceptible to that.
I appreciate that. So just to be clear, like instead we all have our own bio-individuality in many different ways, and neurotype is one aspect of our diversity and uniqueness. But are we nourishing that neurodivergence, or are we just perpetuating more dysregulation? Is that a fair way of saying it?
Yeah, I think so. And I think that not looking at neurodivergence as like a disease or something that has to be fixed, but understanding that if you got this different operating system, you need to learn how to use it. And the way that the world is set up is a little bit less intuitive for you to understand how to use it. And so I think that's just really important for people to understand that, like, the neurotype is not going to like make or break you. It's not like this nail in the coffin kind of situation, but it does mean you have to stand back and look at like, okay, well, how am I living my life and how can I support myself differently? And also having grace around that, right? So we know that estrogen, for example, in the female brain, huge impact on dopamine, acetylcholine, serotonin, so our neurotransmitters, how we utilize energy, the mitochondrial health. And with the ADHD brain, the fluctuations in estrogen can absolutely impact you. So you may find yourself like a week before your period being like, I'm so dumb. Why am I always making mistakes? Why am I always forgetting stuff? I'm so bad at life. And in reality, it's that, no. Estrogen's taking a backseat to progesterone. So does dopamine, serotonin, acetylcholine. Things get a little bit more difficult. You need to restructure your life if you can and change things, because you're not broken. It's that you've got to work with this operating system.
Got it. So a week prior to period, perimenopause, I guess, would be another example of, okay, when estrogen does take a back seat, when there's lower levels of estrogen, symptoms can get worse with what we're talking about, right? And are there any ways to mitigate that? You're never going to change, obviously, these are cycles of life, but is there any ways to decrease the blunt force that can happen, like from a supplement standpoint or mind-body practice? Any pro tips you have there?
So, it's interesting you bring up perimenopause, because we're seeing that's like the peak age that women get diagnosed with ADHD. Part of it is because they have children who are getting diagnosed and they're like, hey, wait, that's not something that everybody, like I need to, investigate this. But it's also because as those hormones change, you can no longer mask, you cannot overcompensate. And in addition to that, you often have additional life stressors, whether you're caretaking a child or you're caretaking a parent. Like, there's a lot more going on in your 40s than there were in your 20s. So, certainly we want to look at hormone replacement therapy if it's warranted, if you're a candidate for it. That can be tremendously beneficial. We also want to look at things like creatine. So everybody's taking creatine for the gains. And and we'll say you take 5 grams for 2 weeks and you will notice better performance in the gym, but you'll also notice better cognitive performance. So it's something that can help your brain. Also, anything that supports the mitochondria, right? If I tell you that your mitochondria already struggle and you have usually higher levels of inflammation, or at least propensity towards immune system dysregulation, we want to be going after that circadian rhythm and making sure that we are doing the light-dark cycles. Expose yourself to light in the morning, get it super dark in your bed, and work on I did a whole podcast episode actually on ADHD sleep strategies, of how to get better sleep, and because it's so crucial. Good sleep, exercise, absolutely. So exercise, people will be like, oh, I'm sore, lactic acid in my muscles. Lactic acid is actually an energy source for the brain. So that's a workaround. This is why I'm in school with kids, really run them in the morning, then sit them down, run them again, take these breaks, get them to move big muscles, because their brain is working a lot harder than the neurotypicals to keep up. And when you generate that lactic acid, you're helping them with more energy in their brain. So creatine can be helpful. We talked about zinc, omega-3 fatty acids, exercise and sleep. there's nothing that exercise and sleep doesn't win in the research. It always wins. But these are like non-negotiables that you have to be working on. And then looking at, to the best of your ability, moving towards a more anti-inflammatory diet. And that's because, as you know, a lot of neurodivergent people also see unfavorable profiles in their gut. And so we want to nourish that as much as possible. With the seat of your immune system being there, if you have a propensity towards immune dysregulation, let's do everything we can to take care of your gut.
Got it. Great tips. Okay, you mentioned sleep, and you covered this at length. They can go listen to the episode in your podcast to learn about your sleep hacks for ADHD brains, or just maybe people in general, because there's so many people that have sleep issues. What are your favorite, like, pro tips for sleep? Getting the best night's sleep of your life.
So this one is going to be surprising, is a dopamine anchor. So sometimes what happens at the end of the day is you didn't get the dopamine that you wanted all day, right? So at the end of the day, you're like, let's doom scroll. Let's watch something like super stimulating on the TV and like get that little dopamine boost. Yeah. We're all toddlers when it comes to bedtime. We need a bedtime routine, and we're also going to fight a bedtime routine. And it's just like, it starts when you're 2 and it never ends. Yeah. So a dopamine anchor can look like something that's low stimulating. So like knitting or crocheting, for example. Okay. It's calm. It's still stimulating you. And if it's something that you enjoy, puzzles are something that work really well. And even puzzle games you can use on an iPad. I recommend that you either wear blue light blocking glasses or get an app on there. But having like a puzzle game where you're getting some stimulation, but it's still a calm way of being. Or maybe you're somebody who needs to listen to a podcast to fall asleep. Shameless plug on our podcast is here. But, that sometimes I will listen to Conan O'Brien, sometimes falling asleep.
Love Conan.
And they're like, because it's super positive and upbeat and they're just joking and I will just, zone right out and go right to sleep. So maybe listen to a podcast, or maybe you need something like binaural beats or doing a meditation. I think what you have to really look at is what works for you, because we talk about all these like perfect bedtime routines and everything. And sometimes the ADHD brain has to doom scroll to like get themselves to shut down. And so it's like, okay, if that's what you're doing now, let's find something a little less stimulating and let's make that switch. And sometimes it just starts with like, let's start mitigating that blue light, because you already have a hard time with your melatonin coming up. We don't need that light hitting your pineal gland and saying, actually, let's get up, let's do the cortisol thing instead of melatonin. And so it's really important to safeguard the screens and make sure that they're not becoming something that like you are leveraging too much that is too stimulating. But sometimes it looks like, okay, how do we do like some harm reduction techniques, right? And slowly step away from that.
Okay, I love it. Great tips. Okay, you mentioned kind of cognitive function. I think you mentioned mitochondrial function too. What do you think of the neurotropic sort of explosion, I guess, within the space? Like, do you feel like there's any ones that you like specifically for the ADHD brain or just people in general?
Bacopa does really well in the research, and we definitely see that people benefit from that. Another one is saffron, which is actually pretty surprising to people, because they're always like, well, I thought for depression, people with ADHD do have a higher risk of depression and anxiety. So it can help in that way. But we know that saffron is just really great for the brain overall. And it does really well in trials when you compare it to placebo and when you compare it to SSRIs. So that's another really great one. And then phosphatidylcholine, there's certain derivatives of that are really great for the brain. So absolutely, like, do you need to like run out and start that now? It's like, maybe, but if you're in perimenopause, that's when I'm like, this is a good idea. Like, this is a good idea to get started, because we already know that as women age, brain fog can become an issue. Women are the highest percentage of the Alzheimer's population. So there is a connection to the decline of estrogen and the decline in brain function. Bringing in estrogen, certainly helpful. And as someone who has prescribed HRT for over a dozen years, I just need you to know it's never enough. Like, it's never enough. You have to be doing the nutrition and lifestyle. And sometimes we do need to add these additional supplements.
Yeah, well said. What do you think of methylene blue? Do you have any thoughts on methylene blue, just from a mitochondrial standpoint?
Yeah, I mean, I've not seen anything in the research in terms of ADHD, but I mean, unsurprising, right?
Yeah, right. Yeah.
I keep saying that, like, you know, by the time you're our age, you're impatient. You're like, I can't wait for research. Like, I only have so much time.
I'm going to be my own N of one.
Yeah,
Dang it.
Totally.
Yeah.
So I think it can be really beneficial. And you see a lot of anecdotal evidence. You know, some people are like, well, that's just placebo. And I'm like, well, if it's placebo and you feel better, then placebo away.
Yeah.
Like, if there's no side effects.
Right, exactly. Going back to your point of like, all right, we say this, we know this. Most research is done on men. There's not enough research done on women. Is there any, I know it's such a complex topic, but like, is there, why? Why isn't more research done on women?
Yeah, well,
we know this, and there's not enough change.
Well, there's more research on erectile dysfunction than there is on endometriosis, which we estimate to be 1 in 7 women. Wow. It affects not just their reproductive health, and it's at least 50% of infertility cases is the estimates. And yet it also is a major driver of anxiety, loss of quality of life, loss of ability to go to work, go to school. Like, it is a major impact, and yet we don't see the funding there. It's, I mean, I don't know. Let me ask you, because you're part of MAHA. Like, is there, I mean.
Am I part of MAHA?
I thought you were. Are you not?
Yeah, well, tangentially.
Okay.
I want America to be healthy, yeah.
Okay. I don't know.
Yeah.
Sorry if I misspoke.
No, I'm just kidding.
Wondering,
I'm just joking around.
Are we going to get more research?
I'm going to talk to a guy that knows a guy.
Okay.
We'll make it happen. No, I don't know. But look, if I had any influence or any sway, that would be one of the top things that I would be doing. Like, we've been saying this for too long in our space.
Yeah.
You cannot be in our world and deal with people that have autoimmunity, which disproportionately impacts women, and not be like, why isn't there more research on ways we can help them?
Yeah.
And understand them and give them answers.
You know, we talk about with like menopause, if men went through it, like, we would have like dispensers of like estrogen cream on the street. Like, it would be like
True.
vending machines
Yeah.
where you would have access to this. Like, it would not be something that men tolerate at all.
Yeah.
But I think that, we see that there's funding issues, there's understanding, right? I think like unfortunately, we don't have, like, we can't change this, but the fact that we haven't had health education that's been comprehensive enough, right? And like, I don't know what like sex ed was like for you, but it was like boys go here and girls go here. And then boys are passing laws now about girls who they don't understand. And it's like, and they're the ones being like, should we fund this or should we not fund this?
Right.
And so it's like
backwards.
We've actually got like a problem that started in childhood.
Is now just coming into fruition.
Yeah.
In all its disorder. Yeah. Okay. So yeah, it's complex, but absolutely. I think my hope is that things start to shift. And I think this is something that probably you can agree with, is like we have so far to go, but the past 15, 20 years, I have seen such a greater awareness on these type of topics, right?
Yeah.
I mean, we have come a long way in the past 15 years, but still a long way to go.
Yeah. No, and we really have. But it is something too that, like, I mean, anyone who works with women, it's like we've got 1 in 10 have PCOS. Roughly, estimating 1 in 7 have endometriosis. Like, how many millions of women have hypothyroidism and don't even know it? Right. I mean, the last estimate I saw was like 27 million Americans, and like half of them don't even know it. And that's like really old information. I've seen no update since. Maybe I need to go dig deeper and look harder. But as you said, like, autoimmune disease predominantly affects women. So we don't have this research. And it's super frustrating that we don't have the research. And then we have a medical paradigm that dismisses anything that isn't a randomized control trial. Like, we watched this happen in the pandemic, where it's like clinical expertise was valued once upon a time. And then something happened as we rolled out of 2020 where it was like, if it's not an RCT, then we don't care about it. And I'm like, okay, we're never going to get research fast enough. And also, the best teachers are our patients. And if you want to help the individual, their experience is sometimes more valuable than the cherry-picked population who went into a study.
Truth. Oh my gosh, that's so good. For people that are like, okay, the ADHD brain, this sounds like me. How do they go? Like, who do they go to get a diagnosis to get some support and tools.
Yeah. I would this is like endometriosis, like PCOS. You are going to meet gaslighting doctors who dismiss you. They absolutely exist. Even ones who say they're like expertise in ADHD, they'll say things to women like, you wouldn't have been able to be married for so long if you have ADHD. You wouldn't be able to have gone to college if you have ADHD, which is just simply not true. So with that, I think word of mouth is really good. Sometimes there's Facebook forums, there's Reddit forums where people will share their experiences. I also think looking at, it can be a social worker, it can be a psychologist, psychiatrist, looking at these mental health professionals and seeing like, well, what do I want support with? If you're like, I don't necessarily want to pursue medication, you don't need the psychiatrist. You can look at a counselor, you can look at a psychologist, you can look at someone else who can make this diagnosis. But if you're like, I'm really struggling, I would like to try medication if this is the solution for me, then you're going to need someone with prescriptive rights to do that. But I think one of the most important things is just starting to understand, is this true for you? Because when you get that diagnosis, it really opens up this level of understanding for yourself. Like I said, women are often told things. Actually, every person with ADHD at some point has been called lazy, unmotivated, like these really derogatory labels that they internalize. And getting that diagnosis can help you shed those things. And like I said, changing your perspective of like, I'm not broken, I'm not dysfunctional, like my, energy centers in my brain and my ability to do executive function tasks may be dysfunctional at times. However, again, I just have this different operating system. And it also means, a lot like autoimmune disease, a lot of the conditions we've mentioned, if you already are starting at a place where I like to say, the ADHD bucket, the default of this system is nervous system dysregulation.
Yeah.
And the cortisol baseline is going to be higher. Your bucket's like 3/4 of the way full. And your friend who's not struggling with ADHD might be 1/4 of the way full. And so they're out binge drinking and they're partying and they're like recovering and fine. And you're like, I'm not. What's going on? Well, your bucket got a little more full from the jump. And so you get a little less leadway. And honestly, as somebody who has multiple autoimmune conditions, as endometriosis, like all of these things going on, people are like, don't you just hate it? Like, I also have ADHD, and people are like, isn't it the worst? And I'm like, I know people don't always love like a positive perspective, but I've always framed things as like, well, like when I look now at like my health and I look at my labs and I look at all these things, like I was actually gifted this as in a way that like I got less leadway, I got less wiggle room. And so what would my life be like if for the past 25 years I wasn't striving to get 6 servings of vegetables and fruits a day? Like what would my life be like? And like, so in some ways it's like, yeah, things are harder. And at the same time, it gave me an opportunity to really elevate my life in a different way.
Yeah, I mean, because there's major superpowers in neurodivergence, right? I mean, what are
people always hate when you say that.
They do?
Yeah.
Okay.
Well, if you're not neurodivergent, you might not know that. But we can unpack that.
Okay, yeah, because I feel like, I'm pretty neurodivergent. I feel like I have skill sets that other people don't have in that, and I think that's okay to say that. But what's the best version of us? How can we show up in the world in the best version of us to get things done? But yeah, what is that? Of course, it offends people. It's like
that's why I was like, people don't always like a positive take. They don't
got it, yeah.
Optimism sometimes because they feel like it takes away from what is inherently a disability, and it's true. So. People don't like the autism or ADHD as a superpower because they feel like it detracts from the fact of like, well, it is a disability and there are things that are really difficult,
Certainly.
right? There are absolutely positive things about it. So I'm odd ADHD, so I'm autistic as well. My pattern recognition is amazing. It's what I love about medicine. I can solve any case. I can write a book in 3 months. Now, let me just say, I won't eat. I'll have trouble sleeping. My husband, who's in the room right now, will be like, "You stink. Get in the shower." So there's that problem. I'm so hyper focused. I can burn out. and I forget about basic needs, and that's not good. That's a problem.
It's not.
So,
but there's a book. There's a project is done.
People will be like, "How did you write that in 3 months?" And I'm like, and people always ask me like, "What's your process?" I'm like, "I can't teach it to you. It's really dysfunctional."
Same here.
It's like, very unethical.
It's called weekends late at night. Yeah, it's not good.
But yeah, so I mean, there are things that are like absolutely strengths, but then there's things like, and this one's just kind of funny, but like if I touch raw silk, I might vomit. Like it's like, well,
sensory issues.
That's my kryptonite there. I just told the whole world. People will be like, throw raw silk over her, like it'll take her down. But I think that it is something that's so hard. I think in the neurodivergent community, because it's like fighting to get the disability recognized, that like there are absolutely like support needs that need to be there, but also not celebrating something to an extreme that it erases the struggles.
Yes.
And I think that, we can always be on the teeter-totter of life and say like, hey, this is like really great. And this is not so much great.
Right.
So, I mean, it is something that I also just think when people have struggled so long to get their diagnosis, to get it recognized, and they're still being denied like things that they need help with, that it feels really like insulting to be like, this is a superpower, because they're like, my life is so hard every day.
Well, that's what I mean. And that's the distinction, I think, is that the superpower is not nourished. The superpower is covered up because they're not getting the support they need, because there's no information. There's no empowerment. So it's like, let's let that strength, that good aspect of the diversity of neurotypes shine. And hopefully through conversations like this, and they can start getting the support that they need. Mm-hmm. Okay, I want to talk to you about a few other things that, we started talking about a little bit before we started recording. You mentioned Maha. Okay, so as your friend, as someone that's known you for a long time, I watch you from a sidelines of you not in the same town.
Creepy.
Like, I feel like social media, dang it. I feel like you have done actually a beautiful job, a very eloquent job at staying true to yourself, even when it's inconvenient, but at the same time, holding your own lane and not, being maybe overly aligned with something maybe you don't fully agree with. Mm-hmm. What are your thoughts? What Dr. Jolene Brighten's thoughts on the Maha movement? Because I don't know, I've seen a little bit, and I feel like knowing you, I feel like, yes, that's true to her. Like she's going to be who she is through and through. And you're going to say, yeah, I agree with some, but not everything. But what's your take on it?
Yeah, I mean, that I agree with some, but not everything.
Yeah, right.
I think
that's a wild thought, though, because it's either you are either with us or against us on these warring sides, and it's like, no, if you even like anything that they like, you are you're evil.
Yeah,
you're a Nazi, basically.
Well, there's that. There's like some study where it was like, how long into a conversation, like an argument, until somebody says someone's a Nazi. Study that was done on the internet. I think that was pre-2020, so I don't know where we're at now.
It's even worse, whatever it is. If it's pre-2020, it's worse.
It's really interesting because, as Maha's evolved, the health got super, super political. And people, regarding you, people will message me and be like, I'm unfollowing you because you follow Dr. Will Cole, and he's the worst, and da-da-da. And don't you know he's like part of Maha? And I'm like, I don't. Okay, firstly, I've known you for like, God, Paleo FX days, like 10 years.
Yeah.
Like, I've known you for a really long time. I know, from what I know of you and my experience with you, is that you care deeply about that people's health, not just people who are seeing you as patients, but people overall. And I'm like, I have a really hard time reconciling that because this person, is supporting aspects of this, that makes them this evil, bad person when I know them in real life. And that's something that always strikes people, like it catches them off guard when I say, well, I know them in real life. And they're like, wait a minute. Like, you don't just know them on the internet? I'm like, no, I don't just know them on the internet. Mm-hmm. There's been a lot of people, though, that have aligned with Maha. There's definitely people who've said things that I don't agree with at all. And I'm like, that just sounds like harmful, but like I also know them, and I just reach out to them and I'm like, what did you mean when you said this? And like, have a conversation. I don't think people are willing to do that. It's also something like I interviewed Alex Clark on my podcast, and my audience, many of them were like, I was so mad when I saw that. And then I listened to the interview and I was like, oh, no, this was really fantastic. And I'm like, this might shock you, but I really like her as a person. And people are like, how could you like her as a person? Like, she's like, you know, she's so pro-life and you're someone going through IVF and like all this stuff. And I'm like, I know it's wild to have like completely different belief systems, but still see a human and be like, I like the human. Like and I'm always like, if I had the faith that she has and the beliefs that she had, I might believe the same thing and follow that. And I don't understand that. So I can't judge her for that coming from that perspective. Like if somebody believes that like, you know, in this higher power that would like smite them if they don't, like that's a big scary thing. Like, so we think about that. Like if I was in that same mindset, then I might believe the same thing. And like, how would it feel for somebody to just judge me from their place and never think about my perspective? But I mean, I just think we've lost the plot in life of remembering that we're dealing with humans. And I think that there are corporations and entities within the government who absolutely benefit when we are pitted against each other. Because if we all actually came together about the things that mattered, like, oh, that would be powerful and unstoppable. But, you know, to your point about Maha, I think there are good intentions in there. I think there are issues in how things are being executed. And I definitely think RFK needs a better spokesperson, someone to run through his speeches, because I'm like, don't say diabetes is an exotic disease. It's like not the best framing. Or, you know, considering things that where you're like, I've never heard of these. And it's like, well, we know you're not a doctor. So maybe you, like, somebody should read through this first. It's a hard thing to, like, I think, you know, people are like, he's so evil and he's so crazy. And it's like, there's things I definitely do not like and I definitely disagree with. And at the same time, when I talk to people like you, it's very much about, like, we need to desperately change things, and this is an avenue to do it.
Oh my gosh, so well said. I actually agree with you 100%. I think that the humanity is lost, the tribalism, the dehumanization of each other, and it's like we know each other for a long time. It's like politics used to be, and this is even a weird thing for me, because like I don't consider these political things. This is like what we've always done that is converging now with food policy and health policy. I'm not a politician. I'm not interested in it. But it's like, okay, someone that's bringing in people in functional medicine within HHS, could you ever imagine that we live in such a day and age? And I'm certainly not going to agree with all the non-health stuff, but the health stuff, I think, is at least bringing experts that, because he isn't a doctor, and the last HHS was a lawyer as well. I mean, people say, well, he's not a doctor as like a pejorative, but if the last HHS was a lawyer, as so is Bobby. So I think that this is something that there's such a cognitive dissonance, right? Because they don't like the administration, their brain breaks and they can't see at least some good. Like you said, what can we come together on, even if we don't agree with the other things, which are certainly, I agree with you. I don't agree with everything that administration does, but the people that I know, like you said, like people that I know that are now involved with HHS, it's because I know them and I know that they're interested in health, even if the messaging is off sometimes. Like whoever was running the social media at that time, where Bobby and the other people he didn't know how to pronounce riboflavin, and it made it like a negative thing. He's like, you know what I mean? It's like a B vitamin or whatever it was. It's like, that was a misstep. Certainly, if I was like managing that, I would be a little bit more, you know, articulate with social media and speeches and things like that, because these are complex topics. And when you know people are looking to tear him down, they're gonna smell the blood in this tiniest little mess up. They're gonna double down and attack him. But I wanted to pack a few things that you said there. But just to maybe echo, like, I completely agree with you on this, that we can agree on some things and come together on, because health is a human issue. This shouldn't be a negative thing. But I'd love to get your thoughts on what don't you agree? Like, what are the things you think aren't good with what they've been talking about?
Ooh, ready for the comments to roll in?
Yeah.
The moms of autistic children will come for me. I think the issue with declaring profound autism and the way that he has talked about autism, when this is so this is what I want to say, especially I think for autistic mothers of autistic children, is that they have not gotten the support they need, and they've been far too neglected in this country. And we have not done our due diligence in improving research for quality of life and really investing in that. I think, so as someone who's part of the autistic community, we'll see things where it's like, well, you're low support needs, so that doesn't matter. And like, there's a whole misunderstanding about the levels and support needs. Someone who's low support needs could become high support needs. They can be burnt out. I mean, you meet these people who are like, I was a gifted child. I went to college at 16. And by 26, I couldn't feed myself. I was like unable to function. I couldn't pay bills, and they've slid into high support needs. The high support needs children don't necessarily slide into low support needs, although they may mature over time and maybe be mid support needs. However, what gets conflated is this idea that everything is autism. This is problematic because when someone says, my child has this learning disability, or they can't speak, or they have a low IQ, and the way they characterize things of like, they can't bathe themselves, they can't feed themselves. This is something that honestly isn't always just autism. And this, I think, is problematic. So from being like, saying things like, children are never going to pay taxes, like all of this stuff, I'm like, don't lead with that, okay?
Yeah.
Don't lead with like, they can't contribute to the society via taxes. But I think the problem with, firstly, talking about autism like it's a disease, it's not, it's a neurotype, but also lumping everything together as autism, that's actually going to hurt these children more. Because, so as you know, my son has had pediatric autoimmune neuropsychiatric disorder associated with strep, PANDAS. This is something that, because I'm autistic, it would be very easy to be like, this child lost the ability to speak, became very violent, couldn't control bodily functions, totally regressed overnight, just screamed and cackled, and sometimes the neighbors would call the police because they're like, what is happening in that house? That happened overnight. Very easy to be like, this is autism. We had a doctor that was like, your child is clearly autistic.
Yeah.
My child's brain was on fire, being eaten by its immune system.
Right.
If we had just put that under the autism umbrella, we would have missed that and not been able to treat that. And that's where I get concerned, is that if we are saying, okay, high support needs, all of these problems are autism, we need to prevent and cure that, and that's what we're chasing down, we need to actually step back and say, well, what about the co-occurring things? So you're going to find out in the research that autistic people make autistic children. So that's kind of scary for autistic people to be like, oh, they're going to try to cure you, when the US does have a legacy of forced sterilization. So that gets scary. And that's where people will say eugenics, Nazi, all of that.
Yeah.
Because it does echo a time in history that was very dark. However, I think what's much more concerning is that, for instance, seizures, epilepsy, very common co-occurring condition with autism. There will be people who say things like, oh, I did X, Y, and Z, and I reversed my child's autism because they're not having these. Well, that was actually seizure disorder. That was something different. And so I just want to make sure that while we are looking at these high support need autistic children, and really looking at how can we support them, that we're not forgetting about the co-occurring conditions that we can actually go in and affect. And I think that is something that I'm like, there's so many people that misunderstand autism as it is. And even the diagnosis, where people are like, oh, well, you have mixed connective tissue disease, and the low, you have low IQ, you have all these things, that's autism. That's not actually autism. That's all these other co-occurring conditions. Yeah. And as you know, from a functional medicine perspective, we can do so much with those co-occurring conditions. Right. And if we are doing more research on those, we're going to help these high support needs children far more than looking at how do we prevent them altogether? And I think instead of looking at how do you prevent autism altogether, we need to ask the question of, what is happening environmentally that's affecting the epigenetic expression that is causing such severe symptoms and other co-occurring conditions. And that's the nuance we're not getting. And as you're right, anything Kennedy says, there is a whole segment of the population that is going to pounce on him. That's why, like I've said in several people's podcasts, I'm like, let me talk to him. Let me just talk to him. Like, let me help him refine his thinking around this, because if what he wants to achieve that, there's absolutely a way to achieve that. But if it's just like prevent autism and you're not recognizing like, well, we've got all these other co-occurring conditions and they operate differently, like we're going to miss actually being able to help them. Does that make sense?
Beautifully articulated. I agree with you 100%. And I know with knowing these people, that's what they believe too. So I feel like there's an artfulness and an articulation, communication thing, a messaging thing more than anything else. But how do we deal with these concurrent symptoms, the moderate to severe symptoms that are there? That's what they're talking about. But it's being lost with sort of broad sweeping statements in a press conference, right?
Yeah.
100% agree with you. Like that has to be the move. That has to be the awareness of people knowing that we're not erasing neurodiversity. We are just helping people and helping families that are really going through a tough time with moderate to severe symptoms.
Well, and as you talk about that, I think I found this really interesting research I came across of like dairy exposure in some autistic children actually causing an autoimmune reaction that affects their folate metabolism. And when they supplemented with folinic acid, these kids went from nonverbal to verbal. That wasn't autism, okay, that was causing them to be nonverbal. That was actually immune system dysregulation, which they may be predisposed to because, again, the gene clusters that ride with that. But that's the kind of stuff that I'm like is so interesting that we need to be looking at, because there's a lot of reasons your child may be nonverbal. It may be motor skill issues. It may be the brain's ability to prioritize motor skill issues. It may be autoimmune. It may be, inflammatory in nature. Like it can be all of these things. And the question is who and why. And that's what we really need to get to the root of. And so it's good to hear that that's what they're after, because the way that Kennedy talks about things, like, saying like we have the autism epidemic that we have to prevent and like we need to like eradicate this. And I'm not sure if he said eradicate, that might be my own interpretation, but some of the language is something that I'm like, I think sometimes the moms of high support needs think like, oh, well, low support needs, they have it so easy, and they're not thinking about high support needs, but we're like fiercely guarded of one another, where we're like, no. Like these people are also part of our community. They're wanting to parse it out as like profound autism and a different, diagnosis altogether. What's interesting is research out of Stanford was like, what makes one autistic person violent and another autistic person like expresses in a different way? And what we found is, regardless of your support needs, regardless of where you're at, it's all emotional dysregulation. It is that your brain didn't prune all of the neurons that the neurotypical brain did. So your sensory input is insane. Like how much information is coming in is insane. And then you put us in this artificial environment, right? As we talk, like under all of these lights and like, but there's screens and there's noises. Like just being in traffic is dysregulating for anybody. So there's all this input coming in, and then you don't have a way to express it. So you'll see autistic people stim. Some will hand flap, some will chew their cheeks, some have fidget toys. Like there's all these things, and some become so dysregulated that they become violent. But what's interesting about that study is they said, it doesn't matter what your support need. It doesn't matter the diagnosis. All autism is the same in what's happening at the underlying mechanism. And that's why I'm like, that's only one example of why it doesn't make sense to separate these things out. What makes sense is to separate out what is the co-occurring conditions, what are the environmental factors, what else is going on, right? Because, we said it that like no one said you had to have one. Like you can have multiple things going on. And I think as well what happens when you're diagnosed, so this happens with patients all the time. You get one diagnosis and that is all your doctor sees and there's nothing else. you get diagnosed with autism and they may not also recognize that like you also have hypothyroidism, or that you're struggling with PMDD, which is a very severe form of PMS that's very, very common among neurodivergent women. Like they start losing the ability to see everything else that's going on.
Yeah.
And I think that becomes a big disservice. And it's a problem in the training of doctors, which is why these families struggle so much. We have to change the training, but we have to look at it as a society as a whole of like, how do we support these families? How do we uphold these people? Because we were never meant to parent alone. Like we were meant to be in tribes. We were meant to have community. And I think women always feel the loss of that. And I think it's even more amplified. As somebody who, you know, we struggled with our son, I think it's been a year since he's had a flare. So we went like 6 years of struggling with pandas. And, you know, it's something that when your child is hurting and you're getting 4 hours of sleep and you're strapped for all that, like you really feel that loss of community. And I think that's something that I'd also like to see the administration look at of like, how do we come in and support these families in a really meaningful way? And that's where I think the mothers of autistic children's voices are best used, because I think autistic people can speak a lot to what their needs are, but they can't speak to what the caregiver's needs are to help support them.
Yeah, well said. I mean, I just on the record, like I agree with everything you said 100%. And I think that's what I'm hearing is it's not so much substantively we see differently, or that, you know, I think most of us within the health and wellness world, the larger health world, agree on most of these things, but I think sometimes the messaging is what the problem is. And I think if anything, more awareness and the nuance and context of these topics, it's called a spectrum for a reason, and not making broad sweeping statements is going to be good for people. And I think we need to do better on a micro level, but also as like on a federal collective level too.
Yeah. Well, and I appreciate you saying that and having this conversation, because it's something that I know I commented on one of your posts before, but you're one of the few people who gets the nuance around this. Whereas a lot of people, it's just like, you know, stop people from being autistic, or, you know, autism is like this disease. And you're very much more about like, autism is a neurotype and there are ways that we can support people. Like everybody can get behind quality of life. We want that for everyone.
But even the way that you worded it, I'm like, I could do better. Like I try to be specific and intentional with my words, but you've taught me in this conversation. I'm like, yep, that's a better way of saying it, because I know what I feel and I know what I see clinically, and I don't always communicate it as well as I should. Basically, what I've learned is that the White House, HHS needs to have Dr. Jolene Brighten as their head of comms.
I'm like, please let me. I'm very good at patterns, and I will see the mistakes you're making over and over.
Superpower.
Yeah, but it is. It is something that, you know, I try to grapple with, because it's like, God, that's such a bad, and I'll hear the soundbite and I'm like, that's horrible. Let me go watch the whole thing. And I'm like, oh, it's not that much better. Like, yeah. And then like I talk with people like you, and it's like, no, but this is what we're trying to work towards, and this is what we're trying to do. And I'm like, that's not what's coming across and coming through. And sometimes I have to remember that it's politics, and sometimes you need to say things in certain ways to appease certain people and to get people to rally behind you. And like, I don't, you know, we're in the health space. We don't totally get that.
No, I don't understand
like,
at all.
We're like that slippery kind of speak. I don't know.
Don't know your
so
slippery
much.
tongue ways.
Yeah.
Yes. No, exactly. Something we also started talking about before we started recording that I want to talk about in front of everybody is this weird time that we're living in since 2020 specifically, where look, it's a human thing. It's always been going on, but I would say it increased, especially in our space since 2020, where we have people like friends, colleagues, people that we know in the space that will self-censor, right? They just will not, like, offline, they'll have big conversations.
Yeah.
And then the camera comes on, the mic gets turned on, and they just don't go there. And it's uncomfortable. It's like off the record. They do not want to go there. What's your thoughts on that? Like this constant self-censorship could be, or they're afraid of the people in the comments.
Yeah.
They're afraid of, especially when you're talking about politics, and even if you agreed slightly on this, the nuance and context can be lost. So they're just so afraid of it, they want to avoid it entirely. What's your take on like what's happening in our space? It's
such a horrible way to live, walking on eggshells at all times. But there's so many accounts now that grow their following on takedown content, right? It's always taking someone down, making sure that you put them in your place, and creating that like us versus them mentality, which I would probably have a bigger following on social media if I participated in, but I have always contended that, one, I know that the people who are part of my community do Nuance well. They're very intelligent, and I don't need to tell them what to think. And I don't think that it is any doctor's job to tell someone what to think or what to do. It is our place to teach them and to provide them with information that, as much as possible, being judgment-free. There's sometimes where like, you're definitely going to judge. Like, I get really pissed when somebody doesn't work up a woman and they just pass her birth control and they're lazy and they're not doing their job and they're like punting her life, right? Like to have to deal with the consequences later. Like, so I'm going to have judgment there, right? Also, I'm like, people, somebody said to me like, oh, you should work on like that rage that you have of like what you've experienced with doctors, like 29 years without an endometriosis diagnosis, being gaslit. I'm like, oh no, I'm gonna hold on to that. I'm gonna make sure no one else goes through that because I'm gonna talk about it so much. But I don't think we should be, things like, whether like it's, good or bad to eat something. That's not our place to tell people. It's to talk about like, this is what you should know. Like when you eat X, Y, and Z, like here are the benefits of it. Here's how it can help you, and let that person choose. When you eat this thing, like everybody knows, like, right? If we're gonna like binge eat a box of donuts, like it's not great for us. Like you don't have to like, present it with judgment. It can be something where you're like very much just presenting the facts of like what's gonna happen to your blood sugar, what's gonna happen to your cholesterol, what's gonna happen so that you understand it. And then you're an adult, make the decision for yourself. So I think it's really problematic. You and I both have podcasts, so we've seen this, and that's what I was talking about. It's like, I'll be talking with someone, they're like laying it down, telling me all this stuff. I'm like, this is fantastic. Let's talk about this on the podcast. Then we get on, and they're like, no, because I don't want like other accounts to come for me. Like I feel, and it's like such a hard conversation sometimes because they're just too afraid to say anything because they're like, I don't want to get canceled. I don't want to get bullied. Nobody wants to get bullied, right? Like, I was bullied in school. I feel like in some ways it just kind of made me like where I'm just like, whatever. This again, like you didn't grow up from high school, fine, whatever. But it's really disheartening, and it's making it so we can't have real and honest conversations. Like you and I are going to have real and honest conversations. People are going to come for us in the comments. Some people are going to love it. Some people are going to hate it, and that's okay. You can disagree, but it's interesting because I was talking about being in a situation recently where I was like, talking with all these people, everyone's super kind to my face. And I know that like, there's things we disagree on. Like these are total like strangers. And I'm like, man, these are like the same people that behind a keyboard would probably rip me apart. Like, but we don't do that in person. And so in a lot of ways, I think we all need to stand back and see like how dysfunctional we've become in society via social media. The algorithm, it rewards rage. So I punish Instagram as much as possible in that when they show me something, which I know they're showing me because it's meant to make me mad, I leave the app altogether and I'm like, I'm going to TikTok. Like I'm going to go to TikTok then. Like I will go over to somewhere else and I will leave this app. I want you to know that every time you show me something that's meant to make me mad, that's meant to like try to get me to attack someone, that I'm going to just leave your app altogether. I think we have to start training the app, all of the apps, that if you show me something, TikTok just shows me food content. So I'm like,
for me, it's whale videos.
Oh, really?
Yeah.
That's awesome.
Yeah, super innocent.
Mine's TikTok is going to be food content, and then Halloween. Is my toddler loves Halloween stuff. So
my daughter loves Halloween. It's like her favorite.
It's my favorite holiday too.
Yeah.
Yes, all the cool people love Halloween. Yes. But I think that we can change that by training these algorithms to be like, not only will I not watch this, but I will leave this app altogether. And it's not good for you to watch that. It's going to spike your cortisol. We can see inflammatory markers rise. Like it's going to cause issues with how your brain is functioning. It can ruin your entire day. So that's something too that when I see like major takedown accounts that all they do is just, it's one thing if you're like, hey, this person said like this food's going to kill you, and I'm going to show you 20 research studies that show that this food is actually beneficial. Like kale, I don't know why kale has fallen out of favor. I think that's fine if like you're not calling this person names, but when I see an account that's like, calling them names, hating on them, being like, you should go report them. I'm blocking that account. I'm like, I'm going to send the algorithm a signal that you are not, I do not want to see anything like this because this is not leading any kind of positive change in the world. And I think we have to, so here's the thing. We didn't grow up with social media. Our children will. And they'll see forever what we left on the internet. And I think about that all the time. That is why I've never done like, oh, I'm going to make this account and be like, this is so stupid and you're a horrible person. Because I taught my children better. I am teaching them better than that. I'm not going to be out there and have them find that of like, my mom said one thing and she did another. I mean, I'm even to the point where like, if I interact with AI, I like say please and thank you. I'm one of those people. But I did it from a place, I was telling my in-laws, because they're like, why are you doing that for? And I was like, because I didn't want to get into the habit of speaking in a different way, of treating anyone in a different way. I didn't want to get in this habit of like, this is just a robot, be demanding, like lose that. Like I wanted to maintain that, like we say please, we say thank you, we say all these things. I think, and I say all this for people to start thinking about how you consciously interact online. And we're not doing that enough. And I'm afraid that as we enter into like AI, not knowing if you're interacting with a bot or not, we're going to see even more disassociation from the humanity and the human that sits on the other side of the screen.
This conversation should be required listening to everybody because it's so true, man. I never heard it said like that. That takedown, like that sort of space of people on social media, that their entire thing is just constant hit pieces and mocking people and shaming people and it's just horrible. And even if they do it in a classy, erudite way and they're trying to be super, academic, they don't know what they've created with their followers because they may not do the dirty work, but they have all their followers are some of the biggest bullies on social media. And they say some wild bullying things.
Yeah.
It's really negative.
Oh, yeah.
And I feel like that takedown content, if you think about it in some ways, it's like almost taking advantage, like you said, of people that are prone to the rage, they're prone to the trigger, they're prone to being offended. So you're getting your likes, you're getting your viral videos, but you are perpetually triggering people that are going through some tough times from a mental health standpoint.
Yeah, and I don't think history is going to look back favorably on that behavior, as I think we will have studies in the future. HHS, listen up. I think we will have studies in the future that show us that kind of behavior led to a lot of mental health problems, whether it's the person being attacked or it's the people doing the attacking. But I think it is leading to really poor behavior in humanity. And I think we are going to see that played out in a really negative way.
Well said. I know I just want to pick your brain on so many things. Another thing was that with us talking more about big food and big pharma and big ag, big chem, now you have these type of people, these takedown accounts on social media say, well, they're coming against big food and big pharma. They're big wellness. Yeah. And it's a pejorative, which I'm like, okay, yeah, we're a group of people that get people healthy. That's quite the indictment. But what's your take on big wellness?
Yeah. Well, it's funny because it just cracks me up. So, I have a supplement company. I started my supplement company because there were prenatals that I was going to take, and then it came out that they knowingly had arsenic in them. They knew it was in their prenatal, and they were still putting it out. Unsafe levels. I was like, no, I want a product that is tested before it even gets encapsulated. And so guess what? I had to make that product. My senior thesis in nutrition was actually on complementary alternative medicine and talking about the supplement industry and how problematic it was. So I set out and I was like, I'm going to do this differently. I'm going to do third-party testing. I'm going to screen for heavy metals. I'm going to look for things like mold. I'm going to freaking do the supplements that I want to take, that I'm comfortable with my family taking, because my family does take it. And so people will come at me and be like, well, why don't you have a randomized control trial? I'm like, I'm a small business owner, okay? I don't have $200,000 for a randomized control trial. Or people will be like, well, you're just the same as and they'll name these supplement companies that are owned by pharmaceutical industries or Nestle or something. And I'm like, bro, I do not have that deep of pockets. And what I'm doing is above industry standard to make sure that it is the quality and that I'm even sourcing things as sustainably as possible. Anyhow, so, people will, even when I explain why I even started this. Like people will often say like, well, you should have just went to work for one of those companies. I'm like, because like they care about people over profits. No, that's not how that's going to work. So I think it's really, and it's interesting because people will say like, well, people don't need supplements. They're worthless. I'm like, you're telling me women don't need prenatals. You're telling me that right now. Like that, oh, well, no, prenatals is different. But, you know, they can get those prescription. I'm like, that come with like food dyes in them and hydrogenated fats. Okay, firstly, hydrogenated fats, come at me. Those are bad. We don't want those. Food dyes, great. You're going to wait for like tons of research. They don't need to be there. And I'm a fan for like, if it doesn't need to be there, don't put it there. Like, don't do it. Anyhow, the whole thing about big wellness though, that like I was telling you, like I try to source the data of like, how did they come up with this number of like, I think it's 1.3 trillion.
Yeah, wellness is worth,
Yeah, way more than pharma.
Yeah.
Okay, well, except pharma owns a bunch of the supplement companies, so they're double dipping there. But what I found, and if somebody's got a better source, I definitely want to see it. But what I found is that vaccines and preventative wellness visits are included in that number. There's other things included in that number because everybody thinks like, this is just supplements, but it's some other aspects of health and wellness that people wouldn't argue with, like exercise and those certain things are also falling in this number. It's almost as if somebody wanted to manipulate this and decided to capture all of this data and just put it under there. But I'll see the one that cracks me up is seeing the graph of like, this is how much pharma makes, this is how much wellness makes. I'm like, but pharma actually is making, like, do you not understand they own like some of that? Like I don't think people follow our food supply enough to understand the consolidation of power that's happened and how there's just a handful of companies that own everything. The same thing is happening in the wellness industry. Mm-hmm. And so when you think like, oh, well, you're after big food and big pharma, but what about big wellness? They're in wellness. Like, they're actually there. Yeah. So, and going, keeping them in check, we saw something like Siete, like, get it. Like they sold for $1 billion. I love that for them. Like you and I knew them way back yes. when.
We had dinner with them in the desert.
Oh my God. Yeah. And when they were like, when I remember when I met them and they were like, oh, paleo, Mexican food. And I was like, oh my God, what? Like, I love you so much.
It's earth changing.
But, keeping pressure on these big food companies makes it so they don't adulterate those things. And I remember people got so mad that they got acquired and that they would be sold. And I'm like, look, like these people worked hard. Like let them get their bag. But also, I'm like, this is a really positive thing when the food industry is like, I recognize the value of a healthy food alternative. It's still processed foods, but it's a healthy alternative. And it makes it so people with food allergies can still consume these things, right? Because like food isn't just fuel and it's not just nutrition, it's also pleasure in life. Fun. But we look at something like that, like the food industry is like, I value this much. Like we saw the same thing like when Epic Bar was bought and people got really mad about that. It's like, it sucks. We're going to see more consolidation, but it's also this really powerful thing that they know that your dollar vote matters.
Right. Perfectly said. Again, everybody listening to this, required listening and viewing. Share this with people. You have such a great way of communicating, I think, the nuance and context. It does get lost sometimes. And thank you for coming on the podcast. Where do people go to learn more about all the amazing things you're doing?
Yeah, well, you can find my podcast, Dr. Brighten Show, or you can go to drbrighten.com, drbrighten.com. And then I'm all over social media. But maybe I don't want to tell you because you're going to hate on me. Dr. Jolene Brighten. But no, you can come. And that's the thing, as you and I talked about before, is like, instead of walking on eggshells, how about we be okay to be wrong and to get presented new information and to change our mind? And that's where things have gone wrong, is that people are like, we want to hold them accountable. And it's like, no, you want to punish them. And there's a difference. Holding someone accountable, and then why do we do that? Because we want them to grow. We want them to change. We want conversations to change. Like, that's okay to do. And that is something that I will say to anybody listening, I think you should speak your truth because your actions have spoken for your lifetime of your character. And I will have people, there will be takedown accounts of me or people who try to come at me and say that I'm doing something evil or wicked or what, they're just making stuff up a lot of the time. And I'm very confident to say, like, I know the caliber of my character and my actions have spoken for themselves in all of this time. So you can say whatever you want about me, and the people who are not my people are going to eat it up and they're going to run away from me, and that's going to be fine. But I think we have to be confident in our actions. And when somebody is calling someone else out and they're getting heated and they're getting you worked up, step back and look at the actions of the individual they're talking about. Like, because a lot of times they're going to take one little thing, hype it up, blow it up. And it's like, really? From this one sentence of their entire existence on the planet, like they should be damned. Stand back and look, like, what has this person actually done with their life? And it is this evil, horrible thing where they're just preying on you and all of that. Odds are it's not. It's not. But as long as you're distracted by that, just wait until big food comes around, because those food scientists are already working on how to override Ozempic and make sure that, like, you stay plump.
Well said. Mic drop. Dr. Brighten, thanks for coming on.
Thank you.